At a recent mobile healthcare conference in Toronto, speakers from across Canada and the U.S. described projects and applications that help medical practitioners do their work more efficiently. One speaker was conference co-chair Dr. John Madison, who said we've only just started to exploit the potential of mobile technologies for improving health. In an interview, he explained why.
The reason I think we've only begun to scratch the surface in mobile healthcare is that consumers carry their smartphones and smart pads wherever they go. Our healthcare delivery system today is focused on what can be done in the clinic and in the hospital. That's very constrained. There are innumerable studies showing that when a patient comes in and you tell them to lose weight, stop smoking, and stop drinking so much, that it's not very effective. We need to adopt a behavioral model, and it's what I call a behavioral symphony for wellness, that accompanies the patient wherever they go and provides behavioral tools that are fun and engaging, that being the gamification of healthcare applications to engage people in managing their own health and improving their own health, and then reinforcing that with social. There is abundant evidence that social networks dramatically influence the health of every individual in that network. And so to the extent that we can exploit social and gaming on mobile devices wherever consumers live, work, and play, we will be able to support them in their own goals for health and wellness. We do not want to implement a paternalistic view of thou shalt do this and thou shalt do that. What we want to do is engage consumers in making their own choices, educated as to what will make them healthier, and then reinforce that and support that through the technologies offered only by mobile technologies.
He also had a few words about the future of mobile healthcare.
10 years from now, what I believe is that the cell phone will become the basis of what I call a PUC, or a personal universal communicator, that will allow us to communicate with people and devices both near and far from wherever I am, and that there be context around who I am, what I'm interested in, what my personal preferences are for communication, what my social network is, and what I would expect as a service or information based upon my location and what my personal preferences are. So to the extent that peripheral devices that will be ubiquitous, particularly in healthcare institutions as well as throughout industry, that will allow us to have large screen displays and various types of input devices, the PUC, or Personal Universal Communicator, is likely to become the true convergence of multiple technologies that manage my identity and my preferences and my communication in a relatively small device, which will allow me to not have to carry around a big heavy laptop or even a smart pad necessarily.
For Network World Canada, I'm Howard Solomon.